Tracking the spread in Texas, the Lone Star State reporting more than 10,000 cases for the fourth consecutive day. 174 more Texans have died. That number shatters yesterday's record of 129. Texas Health and Human Services says an estimated 162,000 Texans have recovered. Thanks for joining us again. I'm Rekha Muttaraj. Every day we give you the very latest COVID-19 case count from the state, and sometimes it's hard to look beyond the numbers and understand the trends. Experts say one thing is clear: the death rate is starting to rise, and it may get worse.
As parts of the country see spikes in coronavirus cases, the death rate has so far remained much lower than previous months. President Trump recently touted this trend on Twitter. But is this actually a hopeful sign in the fight against the virus? These experts say we're not in the clear yet. Here's why these lower death rates might be misleading. First, deaths lag behind initial infections.
What we've seen in the past few weeks is the changing in the epidemiology and the changing in the rate of deaths. You have to remember, however, that deaths are a lagging indicator, meaning that it takes some time for people to get sick, to get hospitalized, and then die from this. So you cannot look at deaths to get a snapshot of what's going on currently.
Second, there are more young people getting infected.
The virus has shifted from the older nursing home population to the younger, healthier population, which we know is less likely to die from the virus. So that could be one of the reasons the mortality rate is dropping.
Increased testing also means we're identifying more non-fatal cases, making the percentage of fatal cases appear lower.
The number of cases that we're diagnosing is actually going up. So we're doing more widespread testing. So that denominator, or the number of active infections that we're diagnosing that could be asymptomatic, is going up. So it makes that percentage look like it's actually going down.
So while doctors do have a better understanding of how to treat the virus, just because the death rate has decreased doesn't necessarily mean we've made definitive progress in the fight against COVID-19. Plus, many experts believe these numbers will increase in the coming weeks, following spikes in cases in many southern states.
We really shouldn't be celebrating anything at this point. You can't look at the death rate now and say that this is not going to be something that changes or increases based on the number of cases and the hospitalization rates we're seeing in certain states.